Hello everyone, I haven't recorded any videos for a long time because we have little time to work every day, almost without weekend. But I decided to record a small video with an interesting clinical case that happened today. The situation is as follows. At 10 a.m. the patient was registered for an implantation. Everything is standard, a classic implantation, an urgent one. About 3 months have passed since the removal. Here is such a picture we see in the picture. Here is such a situation. I open the computer on the tomogram, look at the parameters. I think that somehow it all doesn't look very good. I think that it may be something from the category of some mature bone tissue. Because in the area of the removed 8th tooth, everything is great. When I make the contrast, I see that there is nothing at all. This is a sign of emptiness. Well, let's go to the implantation. Here we look at everything, measure everything, and we see such a picture. The area of darkening, some strange voids that confuse me. But I think I'll go along the way. We will install a plug if we do not receive a torque, and so on. During a visual inspection, everything is fine. There are no serious defects. We make a trepidation hole with a pilot cutter. We put the parallel pins. Everything is great. We work on the cutter, prepare for the implantation. But then there is a problem. I have a problem that I cannot stabilize the implant. That is, to get a torque properly. After the examination, I decide to look at the whole thing under the microscope because the implant just flies away and dangles. I understand that there is a very large cavity in which it just twirls. I start to examine the implant through a microscope. And what do I see? I see a giant cavity filled with fibrous tissue, filled with some remains of either a cyst or something. In general, there is a cortical, and then there is emptiness. Of course, we did a good treatment. Everything was cleaned very well. And accordingly, we did not put any implants. We just sewed it all up and sent the patient for a healing. Why does this happen? It can happen when after removing the tooth, the cyst is not completely removed. Accordingly, it remains there, and such a problem arises. It does not always come out along with the root of the tooth. Here we observe this very much. See what large pieces of cysts, fibrous tissue remain. Therefore, always after removal, do a good, high-quality treatment. Do not leave anything superfluous there. Although the volume is great, everything is fine. But when I took a picture with the implant, I realized that it was just lying in the depth. Here is such a small excursion of today. Bye-bye.